A man in his mid-70s walked into my office not long ago, carrying a quiet frustration that had been building for years. He had done everything right, or at least everything he had been told was right. He exercised regularly, paid attention to what he ate, avoided obvious risks, and followed medical advice without question. Yet, his health was slipping in ways that didn't make sense to him. His energy had drained slowly over time, his sleep had become restless, and his mind felt less sharp than it once was. What troubled him most was not just the symptoms themselves, but the explanations he kept receiving. Again and again, he was told that what he was experiencing was simply part of getting older. That answer never sat well with him, and it shouldn't sit well with you either. Aging does bring change, but it should not automatically mean decline at every level. There is often more beneath the surface, something subtle and cumulative that standard conversations rarely uncover. What I want to share with you today is not about fear or blame, but about awareness. It is about understanding a layer of health that is frequently overlooked, especially in people over 60 who are managing multiple prescriptions at once. As we age, our bodies undergo predictable shifts that influence how we respond to everything we put into them, including medications. The kidneys, which act as a filtration system, gradually lose efficiency. The liver, responsible for processing many compounds, slows its metabolic pace. These changes are natural, but they have consequences. A dosage that worked perfectly at 50 may behave very differently at 70. Now consider that many individuals in this age group are not taking just one medication, but several at the same time. Each one was studied, approved, and prescribed individually, but far less attention is given to how they interact collectively inside an aging system. This is where complexity begins to build quietly. It is not always a dramatic reaction or an obvious side effect. More often, it is a slow accumulation of subtle imbalances that affect energy, cognition, and cardiovascular health over time. These effects are easy to overlook because they don't present as emergencies. Instead, they blend into what people assume is normal aging, when in reality, they may be anything but normal. I'm Dr. Kevin, cardiothoracic surgeon. 25 years operating on hearts that reached the point where surgery was the only option left. I've opened more than 1,500 chests in my career. I've held beating hearts in my hands. I felt the difference between a healthy heart and one quietly losing the battle. For years, some of the worst damage I've seen on that operating table wasn't caused by poor diet. It wasn't smoking. It wasn't genetics. It was caused by medications, pills prescribed with the best intentions that were quietly working against the heart instead. Today, 5 specific medications that millions of people over 60 take every day, and with a 7-minute appointment almost never covers. This is not about scaring you, it's about giving you the information you need to have a better conversation with your doctor. After 60, your body processes medications differently, your kidneys filter more slowly, your liver metabolizes drugs at a reduced rate. The average American over 65 takes 4 to 5 prescription drugs simultaneously. Some take 8 or more. Each drug was tested individually, approved individually. What happens when you combine 3 or 4 in a body already working harder than it used to? That question almost never gets answered in a standard appointment. Let me return to the man I mentioned earlier. For the sake of privacy, I'll call him Clarence. He was 74 years old, a retired electrician who had spent decades solving problems with precision and care. That mindset carried into his approach to health. He walked every morning, maintained a balanced diet, and kept up with his medical appointments. Despite all of this, he began experiencing a deep, persistent fatigue that didn't improve with rest. It wasn't the kind of tiredness that comes after a long day. It was something heavier, something that seemed to settle into his bones. He also noticed muscle cramps that woke him at night and a gradual slowing of his thinking that unsettled him. These changes didn't happen overnight, which made them easier to dismiss individually, but together they painted a picture that deserved closer attention. Unfortunately, each time he sought answers, he was reassured that these were expected changes for someone his age. When Clarence finally came under my care after experiencing multiple cardiac events, I approached his case with a broader lens. Instead of focusing solely on one symptom or one diagnosis, I reviewed everything: his history, his lifestyle, and most importantly, his full list of medications. Within minutes, patterns began to emerge. It wasn't a single issue causing his decline, but several overlapping factors that had been quietly building over time. Each medication he was taking had a valid purpose when prescribed individually. None of them were inherently wrong, but together they were creating unintended consequences that no one had previously addressed. This is a critical point to understand. Problems often don't arise from one decision, but from the accumulation of many small decisions that were never examined as a whole. Clarence's situation was not unique. In fact, it is far more common than most people realize. One of the first categories of medications worth discussing are those used to manage cholesterol levels. These drugs are widely prescribed and have played a significant role in reducing cardiovascular risk for many patients. However, they also influence pathways in the body that extend beyond cholesterol production. One such pathway contributes to the creation of a compound essential for cellular energy production, particularly in heart muscle cells. When this pathway is disrupted, levels of that compound can decrease significantly. For some individuals, this reduction may not produce noticeable symptoms. For others, it can lead to fatigue, muscle weakness, and decreased cardiac efficiency. These effects are often subtle and may not be immediately linked to the medication itself. Instead, they are frequently attributed to aging or other unrelated factors. This highlights the importance of looking beyond the primary purpose of a medication and considering its broader impact on the body. Another group of medications that often flies under the radar includes common over-the-counter pain relievers. These are widely available, inexpensive, and frequently used for chronic discomfort such as joint pain. Because they are so accessible, many people assume they are harmless when taken regularly. However, these medications influence enzymes that play a role in maintaining vascular health. By altering this balance, they can affect blood vessel function and over time contribute to increased cardiovascular risk. Additionally, consistent use can lead to modest but meaningful increases in blood pressure. While a few points may not seem significant, the cumulative effect over years can be substantial, especially in individuals whose vascular systems are already under strain. This is not to suggest that these medications should never be used, but rather that their long-term use deserves careful consideration and discussion with a healthcare provider. There is also a category of medications designed to reduce stomach acid, often taken for conditions like acid reflux. These are commonly used for extended periods, sometimes without regular reassessment. While effective for symptom relief, they also interfere with the absorption of certain essential nutrients. One of these nutrients plays a crucial role in neurological function and cardiovascular health. When absorption is impaired over time, levels can drop significantly, leading to symptoms such as fatigue, memory changes, and nerve-related sensations. Because these changes develop gradually, they are often overlooked or misattributed. In addition, these medications can affect mineral levels that are vital for maintaining a stable heart rhythm. When these minerals fall out of balance, the consequences can extend beyond simple discomfort and impact overall cardiac function. Another important consideration involves medications that prevent blood clot formation. These drugs are essential in many clinical situations and have saved countless lives by reducing the risk of stroke and other serious events. However, they also influence processes that regulate how calcium is distributed within the body. When this balance is disrupted, calcium may begin to accumulate in places where it does not belong, such as the walls of blood vessels. Over time, this can contribute to increased stiffness and reduced flexibility in the arteries. This change is not immediately noticeable, but it can have significant implications for cardiovascular health in the long term. As with other medications, the goal is not to eliminate their use, but to ensure that their broader effects are understood and monitored appropriately. Finally, there are supplements that are often recommended with the intention of supporting bone health. These are commonly used, particularly among older adults, and are generally perceived as safe. However, when taken in isolation without other supporting nutrients, they can behave differently than expected. Instead of being directed primarily to the bones, some of the excess may circulate in the bloodstream and deposit in soft tissues, including arteries. This phenomenon underscores the importance of balance within the body. Nutrients rarely work in isolation. They interact within complex systems that determine how they are utilized. Without that balance, even well-intentioned interventions can produce unintended effects. What becomes clear through all of this is that the body operates as an interconnected system, not a collection of isolated parts. Each intervention, whether a medication or a supplement, influences multiple pathways simultaneously. When several of these are combined, the interactions can become difficult to predict without careful evaluation. This is particularly true in older adults, where physiological changes amplify these effects. The challenge is not simply identifying individual risks, but understanding how they intersect. This requires time, attention, and a willingness to look beyond surface-level explanations. In Clarence's case, addressing these overlapping factors did not require drastic measures. It involved careful adjustments, thoughtful substitutions, and the addition of supportive nutrients where deficiencies were identified. None of these changes were revolutionary on their own. What made the difference was the comprehensive approach, looking at the full picture rather than isolated pieces. This shift allowed his body to regain balance in ways that had not been possible before. Over the following months, Clarence began to notice gradual improvements. His energy levels increased, his sleep became more restorative, and the nighttime cramps that had once disrupted his rest began to fade. Perhaps most importantly, he felt a renewed sense of clarity and engagement with daily life. These changes were not the result of a single intervention, but of multiple small adjustments working together. It was a reminder that meaningful progress often comes from addressing underlying imbalances rather than simply managing symptoms. What stands out most about stories like Clarence's is not the complexity of the problem, but the simplicity of the solution. Once the full picture is understood, it is easy to assume that significant health challenges require equally complex interventions. In reality, the opposite is often true. By removing obstacles and restoring balance, the body can function more effectively with relatively modest changes. This brings us to an important takeaway. Every medication has a purpose, but it also has trade-offs. These trade-offs are not always emphasized in routine conversations, not because they are unimportant, but because time is limited and priorities are often focused on immediate concerns. However, understanding these trade-offs is essential for making informed decisions about your health. One practical step you can take is to create a complete list of everything you are taking, including prescriptions, over-the-counter medications, and supplements. This list should include dosages and frequency. Bringing this information to your healthcare provider allows for a more comprehensive discussion and increases the likelihood that potential interactions or imbalances will be identified. Equally important is asking the right questions. Instead of focusing solely on what a medication does, consider asking what it might also be affecting indirectly. This shift in perspective can open the door to a deeper understanding of your treatment plan and help ensure that all aspects of your health are being considered. It is also worth remembering that not all solutions come in the form of prescriptions. Nutrition, lifestyle, and targeted supplementation can play a meaningful role in supporting overall health, particularly when used thoughtfully and in conjunction with medical guidance. These approaches are not replacements for necessary medications, but they can complement them effectively. Ultimately, the goal is not to eliminate medications or to create unnecessary concern, but to foster a more complete and informed approach to health management. By understanding how different factors interact, you can work with your healthcare provider to develop a plan that supports both immediate needs and long-term well-being. Your heart has been working continuously since the day you were born, adapting to every change and challenge along the way. Taking the time to understand how to support it, especially as you age, is one of the most valuable investments you can make. This begins with awareness, continues with thoughtful action, and is sustained through ongoing conversation with those who guide your care.